Welcome to the Global Health Catalyst Medical Cannabis Education Series. And with me is Dr. Peter Grinspoon. Is that how you pronounce your name?
Yep, grin like smile, spoon like fork. So Peter Grinspoon.
Oh, there we go. I think I nailed it.
Yeah.
So, Doctor, welcome to our educational series.
Thank you so much for having me.
We're very excited to have you here. We're excited to have you as an expert in medical cannabis to answer some of the most frequently asked questions. And I'll start with one. What are the benefits of using medical cannabis?
Well, like every medication, it doesn't work for everybody, and it certainly has the side effects and harms. But overall, it's considered to be a relatively non-toxic option for patients. The most common uses are chronic pain, anxiety, insomnia, and many cancer-related symptoms. While it doesn't cure cancer, it can really help with tolerate the chemotherapy, and it could also really help with a lot of the cancer pain. It also helps people with PTSD, though that's a little bit more of a controversial topic. It's hard to find a veteran that doesn't agree that cannabis helps with PTSD. It helps people with pain syndromes like fibromyalgia. It helps people with gastrointestinal symptoms such as irritable bowel syndrome and colitis. So there are a wide variety of uses for cannabis. And obviously CBD is used for intractable childhood epilepsy. And many Americans are using CBD for chronic pain, anxiety, and insomnia, though we're still gathering evidence about how effective that is.
And what are some of the side effects for using medical cannabis?
Oh, well, certainly it can affect your consolidation of short-term memory. It doesn't cause permanent memory loss, but it certainly can affect your short-term memory. Can cause sedation, dry mouth, a little lightheadedness. And we're concerned about the use of cannabis in teenagers because there's concern about the effects of the development of the teenage brain. We don't recommend it for pregnant or breastfeeding women, except under very, very specific circumstances. And it can destabilize people with psychosis. So we're very careful using medical cannabis in patients who have a history of psychosis or a family history or predisposition to psychosis.
And do people get prescriptions for medical cannabis?
Well, they don't. Great question. They don't get prescriptions. They get certified by a doctor who makes a recommendation. It's still illegal on the federal level, even though it's legal for recreational use now in 22 states and medical use in about 41 states. A doctor makes a recommendation, and then the patient goes to the dispensary and buys whatever he or she wants, because it's not a FDA approved medication yet. So I can't actually prescribe it. I can only certify patients.
Maybe the question that I should have started with that I completely skipped was, who is Dr. Peter Grinspoon and what do you do, I know you work with
Absolutely.
Harvard.
My name is Dr. Peter Grinspoon. I've been involved in the cannabis issue my entire life, both because my dad, Dr. Lester Grinspoon, was a very legendary cannabis scholar at Harvard, and also because my brother Danny, when I was growing up, was a very pioneering medical cannabis patient. He used cannabis during his unsuccessful fight with leukemia. Just when I was a kid, it really helped him tolerate the chemotherapy and to maintain his weight. So I've been interested in medical cannabis my entire career, a quarter-century career as a primary care doctor and cannabis specialist at Mass General Hospital. And I came out last week on 420 with a book about all the harms, all the benefits of cannabis and all the science, called Seeing Through the Smoke, a cannabis specialist untangles the truth about marijuana. So that just came out last week. It's been very exciting, and it's started a lot of conversations, which has been really fun to participate in.
Well, first of all, thank you so much for being a part of this educational series, because there's a lot of myths and misconceptions about cannabis, medical cannabis to be precise. And so to have you, somebody who has invested a lot of time and resources in, this work, it means a lot to have you here at this series.
Well, thank you so much. Thank you for doing the series and for educating people. I agree. There are a lot of real fears that people need to be aware of. There are a lot of imagined fears that have been sort of an offshoot of our 50-year war on drugs. And there are a lot of benefits that are really important. And there are also a lot of things that people tout as benefits that haven't been proven yet. So it's really fantastic that you guys are helping us understand what's actually true and what's not known yet.
Absolutely. And this is just one of the, it's just the beginning of this series. And we look forward to bringing you back to get more into details about medical cannabis and its use.
Happy to come back anytime. I really support what you guys are doing and appreciate it.
All right. And to our viewers, I hope you look out for more series on medical cannabis education by the Global Health Catalyst. And thank you for watching for now. Till next time.